Hi, good morning to one and all. I'm Dr. Priyanka, and we'll be continuing our lecture on prosthetic dentistry in Resto 1. So, the topic for today is principles of our. Okay, so the learning outcomes are there are four of them. So, towards the end of the lecture, you should be able to differentiate between tooth and tissue supported edentulous prosthesis. Describe the forces acting on the removable prosthesis. Explain the factors influencing stresses transmitted to abutment teeth. Describe the methods of stress control in designing of removable prosthesis. Okay, so coming to a biomechanical consideration, this is for your knowledge. Also, designing an RPD is based both on biological and mechanical consideration. We do see the mechanical, but we do forget the biological aspects. So we need to take care of two biological aspects. So first one is whether the tooth used for support can bear the loads falling on it. So we need to see forces falling on the teeth. Okay, so we'll be seeing that in our lecture, and the type of underlying mucosa. So you have to see which place which place you're doing a replacement. Is it an edentulous site in the maxilla, mandible, posterior, anterior? Okay. The resistance to load from a teeth is based on the amount of force falling on it, the duration of force and direction of force applied. Okay, so um there is the principle of the levers. Okay, class 1, class 2, class 3 levers, so we'll be just seeing that in the coming slides. Okay, so those are importance which has to be understood. Okay, so mechanical aspects are these four factors. So one is an RPD. So a lever, mainly a distal extension, which is seen in the photo. Based on a type of lever, the force applied on the abutment teeth can vary. So yes, there are forces which are on the abutment teeth depending on the class, depending on the rest, depending on the um, retainers applied, depending on the uh, minor, major connector, all the components, the basically the force would vary. Okay, the lever has the potential to increase the force falling on the teeth. Okay, so then the cantilever design type of design should be ideally avoided. Okay, in an RPD, yeah, so it would create a problem. It would create displacements, and it's not advisable. Okay, tooth tends to withstand vertical forces and non-vertical forces because of the number of PDL fibers involved. Okay, so it will try and withstand and equalize the PDL forces. So you're supposed to design the process such that the forces are basically distributed evenly. Okay, that's why you have to uh, design all the components properly and include all the components wherever required. Okay, an abutment tooth will withstand non-vertical force if the force are applied close to the horizontal axis of rotation. Okay, so if it is close to the horizontal axis of rotation, the force will be properly distributed. Understand, it will be able to withstand. Okay, if not, then there will be a problem, guys. Okay, so if this is the force, okay, you can see that here's the force in picture A, and here's the force uh, in picture. So sorry, both our bones are A picture, and the tooth corresponding to the clasp are in the B picture or photos. Okay, all right. So you can see the fulcrum line, and you can see sorry, you can see the height of contour, and you can see where they have placed a clasp, above or below, okay, or on it. Okay, so it depends where you want to put it. So as close to the horizontal axis of rotation would be better. Okay, all right. Okay, coming to the lever principle. So there are class 3 levers. You can read in detail about this. Okay, so basically in class 1, the fulcrum is in the middle, effort is applied, and this is the load or the resistance. In class 2, fulcrum is at the corner, resistance or the load is in the middle, and effort is at the end. Class 3, the in the middle is the effort, and fulcrum is at one end, and load or resistance is at the other. Okay, so you have to see and design the processes such that um, if you have a resistance here, if you have an effort here, then it may cause tipping, or it may place the processes properly on the ridge. All right. Here in class 2 example, like in a maxillary denture, class 1, if you have like an eye clasp and here's the fulcrum line, the effort or gravity may push it down. Okay. In class 3 lever. Okay. So here you would have a fulcrum point here, resistance is here, and on the clasp arm, and effort would replace or displace the denture. Like if it effort is like a sticky food or something, it may dislodge the prosthesis. Okay, so you have to see and design the processes well on um, the classes. Usually class 1, class 2 are the most efficient ones, okay, in the levers. Okay, type of movement taking place. Okay, so there are a lot of movements which take place, especially in the rotation wise. So these are the forces or the movements. Okay, so the greatest movement takes place in the tissue tooth supported RPDs. Most common movements are the rotational movements. Okay, so rotational movements have different planes, and these movements are based on quality of tissue, amount of functional load applied, and also the quality of denture base. So usually there are three types of rotation. This is the first rotation. This is the second for fulcrum line is the sagittal plane. Okay. Okay. It extends from distal abutment occlusal rest to the crest of the wrist. So distal to the occlusal rest. Okay. All right. Yeah. Class 1, there are two lines, two such lines, guys. Okay. So here and here. Rotational movements occur in the frontal surface, frontal plane, or facial-lingual direction. Okay, so facial-lingual direction. Okay, so it can cause the movement of the denture, the rocking of the denture, basically. Okay, so it has lesser magnitude, and it induces horizontal stress on the abutment, guys. Okay, so there's a horizontal stress on the abutment teeth. So it is moderately damaging. Coming to the third fulcrum, which is midline, just lingual to the anterior teeth. Okay. So fulcrum is line is a vertical direction, rotational movement in the horizontal plane. Okay, like that. Yeah, the force resulting from this movement is almost entirely horizontal, guys, like that. Okay, and forces can be extremely damaging and should avoid receiving significant attention during the design process. Okay, so we should avoid this fulcrum line, guys, altogether. Okay, coming to the tooth and tissue supported prosthesis. In tooth supported prosthesis, the examples are class 3, class 4. Derive support from the tooth. Okay, you can see in the diagram. The movement potential is less because the teeth provide resistance to functional loading, guys. Okay, so uh, the movements are less because yes, there's resistance from the teeth. Okay, a single universal design can be followed from for teeth supported prosthesis. Yes, the denture base is made up of metal base. Okay, usually um meaning it's preferred, guys. Tissue supported class 1, class 2 tissues, maximum amount of support. The tissue provides primary support and the teeth provides secondary support. Okay, teeth provide secondary support, the tissues provide the primary support. Too much tissue movement because of the dynamic state of the tissue. Okay, there can be multiple complex designs have to be followed or can be followed or are present. Okay, a denture base preferred would be an acrylic resin. Okay, okay, so factors contributing to the amount of stress transmitted to the abutment teeth. Okay, so there are a few factors here. We'll be going through all of them. So coming first on the length of the edentulous span. Okay, okay, so the longer the edentulous span, the longer the denture base, greater the leverage force transmitted to the abutment teeth. Okay, so if the edentulous space is longer, okay, it will have a longer denture base, and then greater leverage force will be transmitted to the abutment teeth, guys. Okay, abutment teeth. All right, so just in the physics world, again, the lever principles, resistance, fulcrum, and effort. Okay, this is the resistance arm, this is the effort arm. So, an example, this is a 3, this is 6. So, the mechanical advantage is the effort arm upon resistance arm, which is the effort arm upon resistance arm, which is 2. So, you can just calculate how big and where you can place the fulcrum line and which lever is more suitable. So here they have just shown an example that this is the effort, this is the resistance, okay, R1, and from here to here is R2. All right, so you can do that designing if you want. This is an example, just an example shown that they're following the same principle of this lever here in this prosthesis. Okay, all right. Guys, okay, so uh, the load, artificial teeth, the length of the dentulous ridge, denture base, all of the following determines the force associated with the abutment. All right, so 1, 2, 3, and 4, or 1, 2, 3. Okay, try retaining the posterior teeth to prevent this problem. Okay, so yes, if you have a posterior teeth, it's always better. Other factors like thickness of the mucosa, amount of occlusal force can also contribute to it. Okay. Coming to the second, that is the quality of the ridge support. So, large, well-rounded ridges are better stress distribution. Okay. So this is well-rounded ridge. This is an eye fish. This is a resort ridge. Okay. So this is just showing the bone type. Okay, so small thin knife like ridges are poor, and tall broad ridge longer denture flange can withstand lateral forces. That's what this is showing. Okay, so the longer the dental flange, more lateral forces can be withstand. Okay, thickness and health of the mucoperiosteum also influences the load transfer to the abutment. Okay, so yes, the mucoperiosteum should be healthy. 2 mm thickness of the healthy mucosa bear greater functional load, so that's why it's like 2 mm thick. Okay, so they're also talking about the mucosa here, so they're just diagrammatically representing it. Okay, thin fiber or flabby mucosa are very poor in withstanding the stresses. Okay, so well-rounded ridges are good. Okay, clasp flexibility. So the flexible clasp is more sought in case of two tissue supported dentures because it transmits less load on the tooth structure. Okay, so wrought wire is the most commonly one which is used. It tends to produce very high amount of lateral stress, but not indicated in cases of poor ridges, guys. Okay, so poor ridges always have a problem in a CD or RPD. So as it cannot withstand lateral stresses leading to heavy stress on the ridge. Okay, so that has to be taken care of. Clasp design should be passive. It should be such that doesn't apply too much force on the teeth. It should just seat properly on the teeth. Okay, it should give support. Yeah, the reciprocal arm should be designed that it lies above the height of contour. Okay, so if this is how you have designed it, it would function better, guys. Okay, so the length of the clasp, the longer the clasp, the more flexible. Okay, the longer the clasp, the more flexible. Okay, and a curved part then the straight path of the tooth surface will provide more, sorry guys, flexibility, sorry, yeah. All right. Coming to the material, okay, so just the same teeth shown in different forms, okay? All right. Uh, Sorry, okay, the material used for clasp construction, okay, so the cobalt chromium alloys based clasp apply more force on the abutment teeth, okay? So thinner diameter cobalt chromium clasp can be used to reduce the amount of force applied. So you can modify the cobalt chromium alloy clasp, okay? Especially in the CPD designing that we do. I mean, um, uh, not the designing that we do. So um, when it comes from the lab, it can be, the instructions can be given. No, that's how they design it. Ideally, that's how they should design it, okay? So surface characteristics of an alloy, okay? So gold crowns are more resistant to clasp than enamel. Abutment restored gold experience more forces than intact enamel, okay? Yeah, so now currently not used, but that's how it used to be. Occlusion harmony is another factor, so it plays an important role. Deflective contact should be avoided, guys. Okay, so processes opposing the natural dentition face more forces than from the natural dentition. Okay, so being adjacent is okay, but when you have a natural fully dentulous arch, they will face more forces. Okay, if this is occluding with the natural teeth. So occlusion force should be directed to middle of residual ridge closer to the abutment like here. Okay, yeah, there guys. Okay, coming to the ways we can manage the stress. So design consideration, controlling the stress. Okay, so we're just gonna look at each of the components. All right, so the direct retention. So the retentive class, the destructive force, and then the abutment. So that's how, if you follow that um, uh, design, then there's going to be some destructive force. So retentive class arm should provide adequate retention with the least force. Okay, so it should basically have a least force, not destructive force, or it's going to give pressure or more force to the abutment. Okay, so this can be done by providing retention from other components of the denture, guys. Okay, all right. So distribute and provide it from the other components. The support and stability of the processes also may be improved. All right. Okay. Class position. So often the spiral position distribution of retentive clasp is more important to retention than the number of clasp. Okay. So the position is more important than the number, guys. Okay. So coming to three type of positions, it's a quadrilateral, tripodal, and bilateral. Okay. Okay, so these are the three positions with the photos. Quadrilateral, one, two, three, four. Okay, so this comes in a class 3 mod 1, modification space 1. Okay, class assembly on both the abutments adjacent to the edential space. Okay, so in case of absence of modifications space, clasp assembly, anterior posterior are given. Um, yeah, clasp assembly is given anterior and posteriorly on the dentulous opposing arch. Okay, all right, like here and here. Yeah. So if this is not present, guys, okay, if the modification is not present, so tripodal is one, two, three, like a triangle, guys. Okay, so this is class 2 mod 1, modification space. Okay, so class present adjacent to the edentulous space. Okay, yeah. On the modification space side, clasp on both the abutment teeth. Okay, yeah, so on the modification side, there should be on the both the abutment for more stability. If the modification is absent, clasp should be placed as far anteriorly and posteriorly of the tooth. Okay, so yeah, if this was absent, again it should be placed the most anterior and most posterior, like if this was absent, guys. Okay, so it should be placed here and probably here, right? Most anterior and most posterior. All right. Not as effective as the quadrilateral configuration, but better in class 2 cases. Okay, all right. So bilateral configuration is a classic class 1, guys. Okay, bilateral, two sides, provide least stress distribution. Okay, on both the abutment teeth. Okay, near to the edentulous space, the um, what do you call, the clasp can be placed. All right, coming to the clasp design, guys. Okay, so we will see like a cast circumferential clasp, and so here you can see circumferential clasp. Okay, or a T class or a vertical projection class. That's the I bar. Okay, so class 2 and class 1 clasp assembly involving disto-occlusal rest. Okay, and retentive tip involving mesiofacial undercut is prevented. Terminal end of such class tipping forces on the abutment teeth. So, if you do not prevent this, they will cause tipping of the forces on the abutment teeth. Okay, it'll cause tipping of the prosthesis as well. A class that originates from the mesioclusive rest and engages the distal, such as a reverse circular, should be used. Okay, to avoid this problem. Vertical projection class, as a T class or modified T, can be used adjacent to a distal extension space. It is used when the distofacial undercut is seen on the abutment, all right? Not indicated in mesiofacial undercut. Um, yeah, and it doesn't apply any stress on the teeth. Or I class is better used involving mesiofacial undercut and mesioclusive rest seats, okay? So when you are using an eye bar, you should take care of these consideration. All right. When you're using a cast like a circumferential class, you can use like a reverse circular clasp and see. All right. Okay. Coming to a combination clasp are used in the distal extension. Okay. With a mesiofacial undercut, guys. So it's more flexible and multiple spartal planes are there. So combination of both cast and wrought wire can be used. Wrought wire is used in the retentive arm and cast metal used on the reciprocal arm, more flexible and produces less stress on the abutment. Okay. Okay, splinting of the teeth. So teeth with decreased periodontal support can be splinted together. So it stabilizes the abutment in the mesiodistal direction. Splints extend anteriorly beyond the canine. The stabilization effect is present even in the facial-lingual direction. Okay, so in most occasions, fixed splinting is lone standing abutment adjacent to distal extension edentulous space can be done. Such tooth can be damaged due to rotational force, and fixed splinting in such situations serves the purpose. So, guys, sorry, here are the photos, okay? Something, so when you join these class, so this is known as like splinting, okay? Right? So here I'm showing the splinting of removable prosthesis. So not done in fixed spin. If fixed splinting is possible, the splinting consists of clasping more than one tooth together in an arch. Okay, all right. Not all clasp to be retentive. Prepared guide planes may provide additional horizontal stability. Okay, right. So we are just giving extensions of these clasps for the splinting purpose, not for the retention. Okay. Result in decreased mobility cause or stabilization is seen. But guys, we usually do. I mean, sorry, we usually don't do all this here. I mean, if there is a weak periodontal status, then we prefer not to do a CPD rather than a splinting. Yes, this is one concept that you should know, but usually not preferred and done. Okay, coming to the, so that's how you can reduce the stress, guys, right? So you should know. Okay, coming to the indirect retainer, all right? So you can see where the forces are, where the direct retainer is, and where's the indirect retainer. So they're just trying to have like a class 1, class 2, class 3 leverage principle here. So you can see the combination and see which one is better, okay? So it prevents the it prevents resist rotation and or displacement of the removable partial denture, okay? It is located on the opposing side of the previous fulcrum line as far as possible, okay? Used in class 1 RPDs, not as useful in class 2 situations. It is used only in the modification space it's present, so that's only when it's going to help. Class 3 situations usually do not use it as there's no lever effect there, okay? So class 4 situation, it's just opposite to the class 1 situation with indirect retainer present as far posteriorly as possible, all right? Okay. So coming to the occlusion, okay. So a smoothly functioning occlusion has to have a good TMJ, okay. So TMJ should be examined without any um, malformations or any problems. The contacts of the remaining natural tooth should be same whether the RPD is in the mouth or not, okay? So all the contacts should be equal and proper. If you place an RPD, you should not have different contact, okay? Or different occlusion. There should be a proper interdigitation, okay? And cuspal contacts. The number of teeth replacing the natural teeth should be reduced to decrease the amount of force lying on the ridge. So yes, you can decrease the number of teeth, but if you have to place the maximum amount, you should place it. But if you can reduce, it would be better. Okay. Artificial posterior teeth should have sharp cusps with low inclined planes in order to increase the cutting efficiencies and prevent horizontal interference force. Okay. So uh, a proper artificial teeth should be used basically, okay? We do have a lot of options in our lab, okay? All right. Coming to the denture base, okay? So the denture base should extend as much denture bearing area as much as possible to dissipate all the forces falling on the process. So the forces will go laterally, okay? So denture flanges should be as long as possible and as extended, not overextended, guys, but so it should extend till maxillary tuberosity for maxilla, retromolar pad for the mandible, okay? Or extension obviously should be avoided, or it would cause displacements, and it would cause premature contacts and lift up the processes. Accurate adaptation of denture base is necessary for proper retention of denture base. Okay. So, of course, the denture mate should be made properly and accurately, so it's adapted well. Okay. The external polished surface of the denture should be contoured properly in order to aid in retention. Okay, so the contour should be proper, the extent should be proper, and it should have a full coverage. All right, coming to the major connector. Okay, so major connector should be having maximum coverage as much as possible in the maxilla. The palatal full coverage is the preferred one, and lingual plate is preferred for the lower, so it dissipates all the forces. Okay, so it's preferred because it covers the whole lingual surface of the anterior teeth and again distributes the forces to all the teeth. All right. um, it is particularly helpful to in splinting periodontally weakened teeth, especially this one. So a little bit is okay, but not too much mobile or periodontally weak teeth can be used. Ideally, a more or less a perfect occlusion should be used for CPD. Um, yeah. It also provides rigidity and cross arch stabilization. All right. Coming to the minor connector, so this is the second last slide, guys. Okay, um the minor connector connecting the guide plane, okay, guide plane to the major connector, also plays an important role for dissipating functional stresses. Okay, so because of its close adaptation to the abutment teeth. Okay, this minor connector helps in two functions: provides a single path of insertion and provides stability by providing increased resistance to horizontal directed forces. All right. Additional guide planes can be incorporated on other teeth to help dissipate the lateral stresses falling on a single tooth. All right. So the minor connector in contact with the tooth, and this is the occlusal force here. All right. This is the horizontal force, right? So it should be designed such that all the stress is distributed evenly. So coming to the last factor, that is the rest in the rest seat. So it's an essential way to transmitting the vertical force along the long axis of the tooth. Rest seats prevent the formation of any lateral stresses. Rest seats should be designed in such a way that they are less than 90 degrees to the path of insertion. Okay? Yeah, in any of the occlusal planes. Okay? Any of the rest seats you design, any of the types of rest seats. Okay? Thus helping the rest seat to grab the tooth securely and prevent any migration. Okay? Occlusal rest seat should be rounded and some amount of space should be present between the rest and the rest seat to allow the free movement like a ball and socket. Okay, like that. So yes, there are principles of designing a rest seat and there are types of rest seats. Please read that and you'll understand better. I guess we'll be taking up in the next lecture sometime. All right, guys. So thank you so much for patient listening. Yes, this is a little difficult um, topic, and it has to be read multiple times to get the understanding. You might not understand it in one time, guys. It's a little difficult to explain also. So please read and refer to diagrams, see videos, and you will understand better, guys. So the reference textbooks are remains the standard textbooks remain the same, which is the McCracken and the Stewards. Okay. These are the standard two textbooks for RPD, that's a removable partial dentures. You can also refer to articles if you like. Guys, I'm always there on Polyclinic 3. For any further questions, please come and see me on the Prosto floor, floor number 20. Um, yeah, and please read and let me know if I can help you with anything. Thank you.